the working together of all the levels of the health service, primary, secondary and tertiary, is fundamental to how we improve things. Through the multidisciplinary team system, secondary and tertiary care work quite well together, but the secondary care has the job of making the diagnosis, and therefore it needs to have the equipment, the CT scanners, and it needs to have enough skilled personnel to make the diagnosis, listen to the patient with the symptoms and do the right test to make the diagnosis, to discuss onward with the tertiary team through the multidisciplinary team. The primary-secondary interface is actually extremely important. If you look at the countries that within Western Europe, they are the ones with well-funded healthcare systems and with academically active healthcare systems. The constituent countries of the UK, the Republic of Ireland and Denmark are bottom of the pile, and they are all countries where patients are expected to get access to healthcare through a general practitioner. Other countries, you can go to see your chest physician by just ringing up, making an appointment. And we have the situation where GPs are required to be gatekeepers of healthcare. And that means keeping the gate shut so that resources are not wasted. It's how precisely they do that that's the important thing. And the nice guidance tells them how wide they can open the gate, although there are still pressures that come from commissioning groups and indeed from senior physicians writing in the BMJ, which say, don't open the gate as wide as that. And that's a big thing. I think it works best, from my experience in working in a relatively small trust, but which historically had very close links with primary care, is that people knowing each other and being willing to communicate and understanding between themselves what is available is a very good way of doing this. And some of the things that have been presented at this meeting also show that with the Leeds lung cancer screening process and symptomatic awareness process, for example, keeping on telling GPs what you're doing has proved a very good way of keeping things up to improve the flow of patients from primary into secondary care.